and thank you for joining us. We continue on a generally positive track in our recovery from COVID-19. I know I joined a lot of parents throughout San Diego County who were incredibly excited to take our kids back to school this week. I know we're excited about increased capacity at the Padres this weekend, and as we prepare to face off against the Dodgers. And we continue to see progress in our vaccine distribution while our cases remain relatively stable. A slight uptick, which is we've talked about for many weeks, not unexpected, but again, some kind of modest changes, but again, staying in an overall very stable way. We do encourage everyone, continue, utilize a face covering and avoid high-risk settings and continue to be safe. But we are marking a pretty significant milestone in San Diego and across California tomorrow, where the vaccine eligibility will open up to everyone, 16 years and older. And so starting tomorrow, all of those 16 years and older, regardless of where you work or underlying health condition, are eligible to receive a vaccine in San Diego County. Like so many of you, I've waited my turn to get vaccinated. I will become eligible tomorrow. And excited to go to the VA in the morning and get my first shot of the Pfizer vaccine. The system should be open now for people to be able to make appointments. 16 and 17-year-olds are only allowed to get Pfizer, and the system is only supposed to make those appointments available to them. But there will be safety protocols on site to ensure that prospect. But I also want to reiterate that as every time we've opened to a new grouping and every time we've opened a new category, it's going to create a surge of people seeking out vaccines, and so there will be the normal frustration that we've been through multiple times about challenges in getting appointments. And we just ask everyone continue to be patient. We've been through this multiple times, and so now we're essentially opening up the vaccine to everyone in San Diego County starting tomorrow, 16 and older. And we're waiting on more supplies and more vaccines and more people to finish their second dose, which will free up more first dose appointments. So please be patient as we work through this system. On the vaccine front, as was widely discussed yesterday, out of an abundance of caution, and again, this was an abundance of caution, I think, to demonstrate the safety mechanisms and protocols can show something that's of concern. People can take a pause and evaluate it. But the Centers for Disease Control, FDA, California Department of Public Health, all recommended a pause on the administration of the J&J vaccine. The state of California, San Diego County, I think all 50 states followed suit in putting a pause while we await additional information. I just wanted to share with you that this pause is going to have minimal to no substantive impact on our progress moving forward as a region. To date, the J&J vaccine only represents 2.9% of total vaccines administered in San Diego County. It did not disrupt any of the appointments at our county-administered network of sites. They were able to sub in Moderna or Pfizer for anyone, so no one had an appointment canceled. Where the J&J vaccine is causing a slight disruption is in some of our outreach programs, our foot pod teams. These are teams that are out that are doing vaccines. These sites paused what they're doing to make the appropriate changes to sub in Pfizer or Moderna, and they will be resuming on Friday. CAL FIRE moved already yesterday to sub in Pfizer for Moderna for their agriculture workers program, and many of our partners are pivoting to Pfizer for homebound seniors. So there will be some inconvenience there, some kind of readjustment that needs to happen, but we will do that while we await for guidance on the J&J vaccine as we move forward. As it relates to homebound seniors, I did want to share with you the state of California is sending some vaccination strike teams deployed throughout California. We have requested and expect we will get one here in San Diego, and these will be teams that will be assisting in the effort around homebound seniors. Again, it's been a challenging work. We have a lot of providers, a lot of folks working to get to our homebound seniors, and so we're very grateful and appreciative to the state. We don't know exactly when those teams will arrive, but we are confident that they are coming, and we appreciate that help as we try and catch up that critical group of folks to help them get vaccinated. You'll see in a minute, we're going to make some adjustments to our dashboard, our vaccine dashboard. And throughout the pandemic, we've tried to share a lot of information, be very transparent about the information and data we have, and then when there's a reason to make a change in how we report it, also share with you that. CDPH and others have now stated that 75% of your eligible population getting vaccinated is the goal. That is where you want to get to as a region. And to date, our dashboard has really been reflective of the percentage of all San Diegans eligible. And so we're shifting it to represent what percentage of the goal that we're striving to get to we are at. And so it'll give us a little better sense of what we're marching towards, what we're working towards. All of our efforts are designed to get to that 75% number. And so I'll show you what the new dashboard will look like. It should update this afternoon. All of the same data is available, and all of the same data will be reported. We're just changing the configuration or the display on the dashboard again to represent our progress towards the goal of 75% of our population. I also want to note that the information we have on our dashboard does not presently include any information from the VA or the Department of Defense. We are working with the VA to get that data, and we think we will be able to add that in the coming weeks. And I want to thank Congressman Scott Peters and his office for helping us and assisting us with the Department of Defense to get the number of San Diego County residents they are vaccinating, so that as we move forward, hopefully in the near future, we can begin incorporating those numbers in so we can get a clearer picture, more accurate picture, more total picture of what it looks like on our progress to our goal. One other thing I want to point out before we jump into our charts for today, you will note in the reports today a significantly higher number of deaths associated with COVID. 25, I believe, is the number today. It is not because there's a significant spike in deaths recently. All of the data we report is preliminary, and in order to ensure the accuracy of our data, we have a quality assurance process in place that goes back and reviews. And in December and into early January, we had a significant number of fatalities that were going. And as a part of working through some of that data, receiving data from CDPH, reviewing death certificates and other information, there's been, I believe, 21 of the 25 being reported today are actually deaths that occurred in December or January, but have now been ascribed to COVID. And so I don't want that number today to spike out and be a cause for alarm, just more a reflection of the ongoing data quality assurance and follow-up work that our county health team does here. With that, let's jump into our charts for today. The first one you see, this is just the revised dashboard. This should be live in a few hours. What you'll see there on the top left is very significant or similar to what you've seen throughout this: the doses received, doses administered, pending documentation. That's just, we know we've given a shot, it's being uploaded into the system. And then the to be administered is just those that are scheduled in the next 7-day time frame. And so you can see that remains the same. What's a little bit different, you'll see there on the right-hand side, is the goal vaccinated. We know our goal for San Diego County is 2,017,011. That's what we have to get to as a region to hit that 75% threshold, which is what's been outlined to us that we should strive to get to. And so what you'll see there in the two charts is the percentage of that goal with at least one dose. And then on the other chart, you'll see the percentage of that goal who are fully vaccinated. So you'll see we are 60% of the way towards the goal we're striving for, which is 75% with first dose, and 37.5% of the way towards the goal that we want to achieve on fully vaccinated. Next chart, you'll see our cases, again, holding relatively steady. You have days where it blips up and down a little bit, but again, from the beginning, we've never said the day-to-day numbers. It's the trend line over time, and what you see with that purple line there, that's the 14-day rolling percentage of positive average. That is holding very steady and even descending or declining ever so slightly. We're now below 2% on our percentage of positive at 1.9%. So that remains very encouraging. The normal fluctuations in testing. Testing, of course, has gone down. And that is not because it's not available. Just San Diegans are seeking the tests less. But we will continue to ensure that the testing will be available, widely accessible for anyone who would like to get a COVID test. And again, our overall case numbers, up slightly from last week, but again, generally holding very, very steady and encouraging. And then the final chart here is just the reporting of our case rate. For those of you that track this routinely, you've been following this chart for many, 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 many months now. And you'll see our unadjusted case rate is reported out this week, 6.3. Our adjusted case rate is 6.0. up ever so slightly from last week, but not of any significance or not of any concern. Our testing positivity percentage, roughly the same. You will note that those two numbers on the bottom left there are technically in the red tier, but just to remind you all that last week the state changed the guidance. There is no danger that we would backslide to red simply based on a case count, and so we are comfortably in orange, where we expect to remain until hopefully we see our cases descend more as more people get vaccinated, hopefully into the yellow, and then with anticipation of that June 15th retiring of the tiers. Let me turn it over to Supervisor Vargas for a quick update, and then we'll go to your questions. And both Dr. Wooten and Dr. Shaw are here for any questions as well.
Thank you, Chair Fletcher. And just want to reiterate to the families and those who adversely were impacted by the Johnson & Johnson vaccine around the country that our hearts go out to you, your loved ones, and our thoughts and prayers are with you. I know that there's a lot of concern from our communities regarding the vaccination, and I want to let everyone know. And just reemphasize what Chair Fletcher mentioned, is that the health and safety of our residents is our #1 priority. This is why our county has a process in place to monitor any adverse events. And so I do want to remind anyone, if you have any adverse effects, to make sure that you contact your healthcare provider and seek medical treatment. Es importante para todos reconocer hoy que primero a todas las familias, aquellas de las 6 personas que han sido afectadas por la vacuna de Johnson & Johnson en el país, que nuestros corazones están con ustedes y sus seres queridos están en nuestro pensamiento y en nuestras oraciones. Sé que en nuestras comunidades hay muchas preguntas y dudas con respecto a la vacunación y quiero que todos sepan que la salud y la seguridad de ustedes es nuestra prioridad. Es importante enfatizar que nuestro condado cuenta con un proceso para monitorear cualquier evento adverso y no nos han informado acerca de alguno en esta región. También es importante que si alguno de ustedes tiene algún efecto secundario, que como siempre les hemos recomendado, que es importante que se comuniquen con sus proveedores de atención médica. El condado continuará monitoreando la situación y esperamos recibir más orientación del gobierno estatal y federal próximamente y los mantendremos informados. Por último, nos estamos preparando ya que a partir de mañana todas las personas mayores de 16 años podrán vacunarse. Quiero recordarles que la disponibilidad de vacunas depende del inventario, pero el condado sí tiene la infraestructura para adaptarse a esta expansión. Esta semana incrementamos el número de vacunas en varios de nuestros sitios sin cita en algunas de nuestras comunidades más afectadas. Para programar su cita o más información puede visitar el coronavirus-sandiego.com/vacuna. También seguimos con nuestro trabajo de equidad y es por lo que continuamos colaborando con organizaciones comunitarias confiables para organizar eventos de vacunación que son fundamentales para alcanzar nuestras comunidades. Muchísimas gracias.
All right, we'll go first to our call-in questions.
This first call is from Adam Marqueson with ABC 10.
Yeah, hi, Supervisor. Some counties have turned into vaccine destination spots. If people can't get a shot in the county where they live, they go where they can get that appointment. Are you worried when things open up tomorrow, San Diegans will also be competing with people from across the state for local appointments? How do you plan to combat that, and do you plan to combat that?
No, we're not particularly worried about that. Counties are all getting allocations. It's probably a greater concern in the early days when we had much more infrastructure built out than the surrounding counties. But I think certainly other counties have caught up with this. I mean, it's a really small, like less than 1.5% of the totals of our vaccines that come from a different zip code, and we attribute the vast majority of those to people who work here, travel healthcare workers, people who live in Temecula but work at a healthcare facility or some other place. And so we think as the entire state has stood up their infrastructure that is much less of a concern.
This next call is from Brandon Lewis with Channel 8.
Hi, Supervisor Fletcher. Is the county aware of any serious reactions to the Johnson & Johnson vaccine among local residents or vaccines it distributed?
Yeah, I don't believe so, but I'll have Dr. Wooten. Dr. Wooten shaking her head no. We're not aware of any
Okay.
adverse
and
reactions
also,
to J&J.
what happens? What's that?
Yeah, we're not aware of any adverse reactions to J&J from San Diego County.
Okay, thank you. And then how many Johnson & Johnson vaccines is the county holding, and what happens to those vaccines in the interim?
Yeah, so the total of everything administered countywide, again, was about 2.9%. We have about 11,000 J&J vaccines that we have, and we'll hold on to those because we don't know what's going to happen, and we will wait and see. Again, those were all planned to move into predominantly a lot of those harder to reach communities and areas. They were all attributed to that. We are shifting those out with other vaccines, so those programs can continue. But we will hold the ones we have and await further guidance from FDA and CDC and California Department of Public Health.
No risk of expiration?
I don't think so. Let me ask Dr. Wooten if there's any risk of expiration of those vaccines.
Good afternoon. The beauty of the Johnson & Johnson vaccine is that it can last for 3 months when it's refrigerated. Unlike the other two vaccines that we are currently using, the 2-dose series of Pfizer and Moderna, it has a much longer refrigerator shelf life.
Thank you.
Thank you.
And our last call is from Paul Sisson with the San Diego Union Tribune.
Thanks for taking our calls today. My first question has to do with the current supply situation, outside of the J&J doses that are currently being held. Are appointments still being just snapped up the moment that they're put out? I guess I'm just trying to understand what is the supply scenario that this expanded group of people is now kind of landing in when everything opens up tomorrow.
Yeah, Paul, the supply of vaccines next week may dip just a little bit overall. It's been kind of steady. Of course, we don't always know. Sometimes some come in late. We have seen good utilization and uptick of appointments. There was a slight slowing in the last few days, but they were still all eventually being taken, but they weren't immediately gone. We predict tomorrow they will go very rapidly and very quickly. And we still haven't seen this significant jump in supply of vaccines that we keep anticipating. Week over week, we've seen some steady climbs. A few weeks that were a little bigger jumps than others. We think next week could be a little bit lower than what we got this week. But again, the anticipation and what's been conveyed is the numbers are going to continue to increase. So supply is holding relatively flat, dipping up and down a little bit week to week, but relatively stable. And then the demand for the vaccines, again, anecdotally in the last few days, say 3 to 4 days, we'd seen appointments be there for a little bit longer, but we're still all being taken. And we expect that will change tomorrow. And we'll be back at a place where it's very hard to get an appointment for a little bit.
And then I also wondered with the vaccine dashboard numbers shared a little earlier, you said about 2,017,000 and something vaccinations is the goal, and that would represent about 75% of the population. But that's not quite right. I get a lot of phone calls on this from people who are following this on their own, but we've got 3.3 million people in this county. By my math, 75% of that would be 2.5 million, wouldn't it?
Yeah, but Paul, there's not 3.3 million people that are eligible for the vaccine. The vaccine is only eligible for 16 and older. So if you take your 3.3, you adjust it for those 16 and older, I think you arrive at about 2.6. You take 75% of that, and you arrive at just over 2 million.
So I guess the question that people wonder then is why don't you include kids? Why aren't we saying that kids also eventually need to be vaccinated?
Well, because the vaccines.
Is there some reason why kids aren't part of herd immunity?
Well, I think right now it's because the vaccine is not eligible for kids to receive. I think at some point if that changes, then that goal could change. But you can't. It's hard to set a goal to say vaccinate X percent of a population when it includes people who are not eligible for it. So, we're following the guidance that's put out by the state and the federal government to achieve 75% vaccination for those who are eligible to receive the vaccine. That's what we're striving towards. If it changes where it becomes eligible for kids, or if the guidance changes and they say there's a different goal, then we'll change as well. But right now we're following the guidance that's been given to us.
And so I wonder, technically, don't we need to vaccinate kids as well to reach a state of herd immunity?
Yeah, I'll let Dr. Witten weigh in on that.
Paul, thank you for your questions. Currently, the FDA approves the age range based on the clinical trials and what ages they are tested in. And so if we use the vaccines on ages less than 16, that would be off-label, if you will. So right now, the only vaccine that is approved for 16 and 17-year-olds is the Pfizer vaccine. And Moderna is approved for 18 years of age and older. The pharmaceutical companies are going through conducting trials right now for ages 12 to 15 years of age. And as I think I shared this with you last week, this after it's approved by the FDA and CDC, this vaccine would be available later this year. And then clinical trials are also going on for 6 months of age to 11 years of age, and those most likely will not be available until next year. Right now, the vaccines that we have are only eligible to be used in those individuals 16 years of age and older, and for the 16 and 17, that is only Pfizer. Okay?
Right, yeah, that's not what I'm asking, though. I'm certainly aware of the current approval schedules. What I'm saying is, you know, you can't get to 75% of the population vaccinated without vaccinating kids, can you?
Well, the goal is not to get to 75% of the overall population. It's to get to 75% of the population that is approved to receive the vaccine, and that is 16 years of age and older. Now, many of you may have heard Dr. Fauci talk about we should probably disband the percentages. The goal is to get everyone who's eligible to be vaccinated, vaccinated. And right now, that is 16 years of age and older. Certainly, we want to vaccinate our children, but the clinical trials have to be conducted first to determine the safety, efficacy, and effectiveness of the vaccines in those age groups. So we still have to wait and see until those trials have been completed. Thank you.
Well, you had a second question, I think?
No, that's it. Thanks.
Okay, thank you, Paul. Go to our text questions.
This first text question is from Jonathan Wozen from the San Diego Union Tribune. He wants to know, what is the timetable for continuing or gradually closing county-run COVID testing sites in the month ahead?
Yeah, we think it's important to maintain a robust and accessible testing network throughout San Diego County, and we are maintaining that. As we go forward, given the significant decline in demand, there could be some modest adjustments to hours or perhaps locations, but we're very committed to ensuring that a COVID test is available, is accessible, and is distributed throughout San Diego County. And so we're going to maintain our network of sites. Again, there could be some modest adjustments in timing or perhaps some consolidation of sites, but we're going to keep that as a resource that is there to the public. We think it has an important role to play. And we encourage anyone who wants to get a test, please know it's available at no cost, and you can get it. And then obviously as we head in, to late summer months, we'll reassess. But for right now, the plan moving forward is to continue to make sure that testing is widespread, accessible, and available for any San Diegan who wants one.
This final text question is from Mike McKinnon with KUSI. Texas lifted all restrictions weeks ago and has seen a decline in cases and hospitalizations. Why can't San Diego County expedite our reopening process since our cases are also down?
Texas has a death rate almost double that per person of San Diego County, meaning if we had followed the model of Texas, we would have almost twice as many dead San Diegans. So I don't think Texas is a model that we necessarily want to follow. We are opening things. We've seen considerable progress in opening. We're doing it safely. We're doing it responsibly. And we're going to continue on the path we're on. And I think that concludes our briefing for today. We appreciate everyone who joined, and we'll be back with you next week. Thanks.